It's been a lot. I mean, it's been a roller coaster, and it's hard, and we're tired.
You know, we still have to take care of the normal stuff that we were taking care of before COVID in the non-COVID ICU, and then you have this kind of different world when you walk up into the COVID ICU.
It was just hard to come to work. Day in, day out, you're coming to the hospital, you're caring for all these patients who have COVID, who are struggling to breathe. It's hard to watch.
We're trying our best to deal with the hands that we were dealt.
To be able to take care of, at times, I think we've had upwards of 50 ICU patients in a hospital that only has 26 ICU beds and do it well. I think that's an incredible accomplishment.
It's one foot in front of the other. Just, set yourself a goal. And for us, I guess the goal would be that next shift. Just make it to the next shift, make it to the next week.
This illness doesn't define them. Who they are in these moments isn't who they actually are. They are the person who they were before they came in. We have to get to know them. We have to be there for them, because if not us, then who? And there is nobody else, because they don't have anybody else.
I really try to advocate for at least getting them to FaceTime with family. I'm a super big supporter of that, just because I know they want to talk to their family, and I know they want to be visited by them. So I feel like that's the closest thing.
Being able to be with someone in those last moments and let them know that you're there, that they're not alone. It does help me to keep going in that regard, just feeling like I do provide some sort of hope in their last moment or some sort of comfort.
Everybody that works here wants to provide the care that we are used to, what we've done for decades.
It's just very challenging, and we're doing our best.
Sometimes after work, especially after really rough nights, I'll just sit in the parking lot. Either listen to music to just kind of decompress. One of these days I'll get a hot tub. I'd like to be able to sit in a hot tub after work and just that's my goal.
We want to do the best for our community. We are doing the best for our community, and we love our patients, and we want them to do well.
We get those small moments where somebody that we really thought was going to do very, very poorly finally makes it out of the ICU or finally makes it out of the hospital. And those are real celebration moments. So you take those small moments and you try and amplify them as best you can.
I have a passion for this type of nursing and these type of people, and I want to see them get well, and a lot of them won't. But I pray for wellness for people.
Yeah, I feel like I got a job to do, and got to finish it.
I'm tired, but I definitely lean on my fellow coworkers because we can all relate.
I see a team of people that haven't stopped doing their job, haven't stopped coming to work, despite a culture at times out there that has told them that maybe their work's really not necessary because this doesn't exist or it's not really that bad. Well, they know it's that bad, and they've still kept coming. I think I walk into that ICU and I see some very eager young faces that are not as eager and not as young as they were a year ago. I think the people that are still here are the ones that understand that we have to stay together, stick together, work together, and really survive together to get through this.
A, the community needs us, but B, we rely on each other so much. Even if you're not feeling very well, mentally, physically, you got to show up the next day, because if you don't, one nurse makes all the difference, especially one strong nurse can make all the difference.
We've all been going through this together. We've been here from the start together.
Through all of this, I've been thankful. We have so much support from our docs. Despite us having a huge surge and being team nursing and being stretched really thin, I do feel supported by this organization.
Coworkers is the biggest help around here for sure, and the doctors are awesome. They all understand what we're going through. And some of these teams you get put on, real solid crews. We get people from PACU and whatnot. It's just, sometimes you have some real good days with good coworkers for sure.
The staff has been amazing and very supportive in doing things that I've never seen staff do in an institution. I've worked at several different hospitals through my career in several different locations in some great places. And I don't think, that at those places we would have been able to accomplish a lot of the things that we've accomplished.
I'm really proud of this organization. I'm proud of what we're doing. I'm proud to be here, a part of the work that's going in, and it is work every day.